Hello, everybody. I'm Genet Chenier, and this is the always interesting, always informative joy in our town. Our topic today is homelessness. We're going to talk with the president and CEO of the Houston Housing Authority. He is none other than Tory Gunsolley, and we, of course, can trust his information because this is what he deals with all day, every day. Welcome to this program. We're so glad you're here.
Thank you. I'm happy to be here.
I'm happy that you're here, too, and I'm really glad that you'll bring clarity to lots of us who don't really understand what the Houston Housing Authority represents and how it ties into homelessness and affordable housing all at the same time.
Sure.
Tell us why there's a need for the Houston Housing Authority as it pertains to homelessness. How do the two intertwine?
Well, I would say until recently, they didn't necessarily intertwine, other than the fact that the Houston Housing Authority provides quite a bit of affordable housing. And if that housing didn't exist, folks could go homeless. But recently, the Housing Authority has really stepped up to the plate and said, we want to be a part of the solution here in Houston. The Houston Housing Authority has dedicated over 2,000 units of housing specifically to help end homelessness.
So let's talk about the homelessness aspect of it.
Sure.
You say help end it. Tell us what homelessness looks like from your perspective.
So in Houston, we have one of the largest homeless populations in America.
Wow.
On any given night, you have over 8,000 folks who are homeless. Over the course of the year, that might be 20 or 30,000 homeless individuals. And there are different types of homelessness. And the types of homelessness that we're specifically focused on ending are veterans homelessness and chronic homelessness. And then we'll move to other subpopulations within the larger homeless community.
I'm hearing what you're saying, and I don't know that I've categorically it makes sense. But give us, we know that we're going to focus on what 2 or 3 of those categories, but tell us what the categories are.
Sure.
Now that you've mentioned that homelessness is categorical.
So HUD defines all sorts of different target groups and provides different types of funding for different types of homelessness.
Now give us
some examples.
What is HUD?
HUD is the Department of Housing and Urban Development. And they provide about $25 million a year to the city and county here in the Houston area to try to help combat homelessness. And you have short-term homelessness, people who are doubled up with friends or relatives. Couch surfing is something that it's called. You have youth homelessness of kids who have aged out of foster care and just don't have any place to go. And then you have the homelessness that a lot of people think about with homeless veterans who are on the street, and you might see panhandling and that sort of example. And then you have family homelessness, where people have been evicted and they have kids. The Houston Independent School District has a full-time coordinator of homeless services because the need is so great.
My goodness gracious! Now you said that we're going to focus on particular categories.
Correct.
Veterans. I know that children and moms and dads, families, must be a part of what we're going to talk about, or what you want to talk about.
So in Washington, D.C., there is an agency called the Interagency Department to End Homelessness. And they are made up of representatives of all of the different branches of government, including Homeland Services, the VA, which is Veterans Affairs, HUD, Health and Human Services, Department of Education. And the president has tasked this agency with saying, everybody are doing different things to try to solve this problem. How can we get momentum around solving the problem? And they have said nationally, we need to end veterans homelessness first. And then we need to focus on the chronic homelessness. And the reason that we're focusing on chronic homelessness is the chronic homeless cost the system an amazing amount of money, and it is so much cheaper and cost-effective to just provide them a place to live.
Define chronic homelessness for those of us who don't know.
So chronic homelessness would be an individual who's been homeless for over a year or has had more than 3 episodes of homelessness within 1 year.
You know what? I'm going to ask you to stop there and just give us a real definitive explanation for what homelessness means, period. And then we'll move back into that chronic homelessness.
Yeah, wish it was that easy.
I know.
And you have probably 19 different definitions of homelessness, depending on who in Washington is deciding this is what we're counting and this is not what we're counting. But basically, homelessness is someone who doesn't have a home, and it's as simple as that. And different programs will define it differently about, whether you've been evicted and whether you're doubled up with another family. Does that count? You're living in a shelter, or are you literally living on the street? But generally speaking, if you don't have a place to call home, you're homeless.
So even if you're living with friends and you're, what you said before, couch surfing, if that is not your home,
right,
then you are categorically at least homeless.
Under some of the definitions, you're homeless, yeah.
Okay, I see what you're saying. So now let's go back to chronic homelessness.
Sure. So chronic homelessness is what most people would think of as hardcore homelessness. People who have been living on the streets for years. And that's really the chronic homeless. Usually it is singles, not families. It's very difficult for a family to be homeless for a continuous year. But even families can fall into chronic homelessness when they have multiple episodes of homelessness, and they might be at a family shelter for 30 or 60 days and then find an apartment and not be able to make ends meet, and then be evicted and be back out on the street again and back to the shelter again.
So when you say, when you talk about cost effectiveness and what's just better for the community overall, you address chronic homelessness as something that should be eliminated quickly because of the overall cost of maintaining the individuals that for whatever reason can't seem to get on their feet and find affordable housing, which we'll talk about in the next segment.
And I think, first and foremost, more than it's a cost effectiveness, I think that there's a moral outrage
there we go. That's what I wanted to hear you
that there is homelessness anywhere.
Yes.
But as a bureaucrat, which I proudly admit I'm a bureaucrat, it makes good policy.
Sure.
And people on any end of a political spectrum can recognize that if you have a chronic homeless person who is using the jail to get housing, is using the emergency room for routine medical care, they are taking a tremendous amount of resources from the community to get their daily needs met. Studies have been done across the country, and the most famous example is of a gentleman in Seattle called $1 Million Charlie, and they tracked this homeless individual, and he was costing the system $1 million a year.
Come on.
Through emergency room visits, through the jail visits, and the average cost to take care of him and provide him a caseworker and a home could be less than $1,000 a month. And so from a fiduciary responsibility standpoint, it just makes sense to say there's got to be a better way. And that's part of what we're trying to do here in Houston, is attack that problem. And we've seen great partnership with the city and the county and the healthcare system and the jail. I mean, everybody gets, boy, we're spending a lot of money on this chronic population, and there has to be a better solution. And so that's one of the big changes that's happening.
And then the veterans, I don't think that, maybe I don't often think about the fact that you talked about individuals that you see with the signs, and that many of them are veterans. I don't know if the average person just driving along in traffic really recognizes that, because you hear different comments concerning addiction and substance abuse, that kind of thing, and that's the kind of person that we're looking at. But you're telling us that that's someone who has sacrificed their life for this country.
Absolutely. In Houston, the estimates are that 1 in 5 homeless individuals is a veteran. And you have the VA here, who is doing a lot of work, and we partner very closely with the VA. As a matter of fact, right now we have a staff person who's spending part of her time at the VA drop-in center, which is where homeless veterans come to the VA and say, I'm a veteran, check me out in the system, please give me help. And the Housing Authority is putting a person right there where the veterans are coming, so that we can then take them through the process of giving them a voucher and eventually a home.
That's awesome, because I always thought that veterans received variations of amounts, but income for having served and benefits.
Yep.
And so when we talk about like the chronic homelessness versus the veteran, it seems like the system's already set up to take care of the veteran, and I don't know that we understand why that's not happening.
So there are a couple of reasons why it doesn't happen. One, there's a tremendous backlog at the VA in terms of processing benefits, and some vets haven't gone through the process, and it's disabled veterans. So it is literally, it's not just you served our country. It's like you served our country
and you were disabled.
And you were disabled.
Oh my!
That's who receives benefits. And there's been lag, or people will lose their benefits for one reason or another. And then some people have their benefits, but the gap between the amount of their benefits and what rent costs is too big, and they just can't find an apartment for the amount of their benefits.
Okay.
And so that's kind of gets to the whole question of affordability. But it has been neat in this past year. Our partnership, we've really started working on how do we house these veterans as quickly as possible.
That's important because, you know, I'm certain that veterans must lose their lives, you know, to go and fight for our lives and then come back to your home and lose your life under a bridge, or with, you know, it just doesn't seem right. So in the next segment, we're going to talk about affordable housing, and this is a great segue into that particular topic, because at the end of the day, it does boil down to dollars and cents and what's affordable and what's not. This is Tory Gunsolley. He is the president and CEO of the Houston Housing Authority. Physical address is 2640 Fountain View Drive, Houston, Texas 77057. Phone number 713-260-0600. 713-260-0600. Website www.housingforhouston.com. www.housingforhouston.com. I am really, really happy that you've taken the time to give us those definitions, paint the picture that we can see, so that when we move into the segment coming after this, after the PSA, then we can talk about affordable housing as it relates to the really problemed areas in our community. And from what you're telling us, that's the chronic homelessness, veterans that are homeless, and is there another category?
Well, and then you get to family homelessness.
And then family. So family, veteran, and chronic, yes?
Yes.
Okay, we'll be back in just a moment, and we are going to expect and hope that you're going to be waiting for us on the other side of these PSAs. Don't go away. We are back in this segment with Tory Gunsolley, the president and CEO of the Houston Housing Authority. We've covered the area of homelessness, and now that we've given definition to it and the different compartments, we're going to talk about affordable housing, which is directly related to that. So thank you for staying over with us for another segment, and let's just jump right into it. Tell us, you talked before about how affordable housing for veterans is a problem, and the Housing Authority is obviously trying to address that problem. Tell us, is there a huge gap between the income that those whose incomes are subsidized receive and what it costs to house? Is there a huge gap?
There's a huge gap across the country and here in Houston. So to be eligible for many of our programs, you would need to have income of less than 80% of the area median income. In Houston, the area median income is about $66,000 a year. And so at the top end of our programs, you could have a family of four, like at $45,000 a year.
Okay.
In reality, most of our tenants, the average income is about $12,000 a year. So you can tell,
my goodness,
we're not serving people at 80% or even 50% of the area median income. We're serving people who are more at 30 and 15% of the area median income.
Tory, I want to ask you this, and this is something I've asked so many our guests concerning this topic so many times. I don't know that I'll ever be satisfied with the answer, but why is it, if we understand that the majority of our community is making X amount of dollars.
Mm-hmm.
And then we have what's quote unquote the low income housing that does not in any way match.
It does not begin to address the need. Yeah.
What is that? What is, it's like two different worlds.
It is. It's a question of national priorities and local priorities.
It's not a common sense priority?
It could be a common sense priority.
I'm sorry.
I mean, Congress in 1949 set a national housing goal that every American would have a decent, safe, affordable place to live. At 1949. They have never funded a program to make that a reality. The need is,
really?
Yeah, the need is so great. Our waiting list was open for a spot in line. This is not even for a unit. This is just a spot in line. And we had 80,000 households apply in 7 days.
And they qualified. You're telling me 80,000 people qualified.
Wanted to get in line. Well, we couldn't put all of them on the list. We put 20,000 on the list. We had a lottery. But that's just in Houston. You have between 100,000 and 300,000 households who need affordable housing.
It just doesn't make sense to me. And you know, you're the president and CEO, and so what I think I hear you saying, it doesn't make much sense to you either.
It doesn't. I mean, I could build a lot more housing if I had the funds to do it. I could create a lot more margin in people's lives if we had the ability to do it. It just, from a national perspective, the funding has been going down, not up.
Would you say that that is one of the major challenges that you face, is trying to connect the dots so that it matches?
At this point, it's not even arguing for increased funding. It is just trying to keep the funding that we have. We've been hit by the sequester that your audience has probably heard of. Mm-hmm. And that has literally cost us millions of dollars. And we've had to make decisions about, do we serve less people, or do we keep serving the same number of people that we serve today, but they have to pay more? And, you know, these are folks that don't have a lot of extra dollars around.
Well, from what you're telling us, they don't have any extra dollars around. So how can an increase even be considered?
A $50 a month increase is a huge hardship. We made the decision, because of the way that the federal funding works, that we were going to continue to serve the same number of people. Because if I served less people this year, I'm funded for less people next year. And it just creates this cycle where I would be serving fewer and fewer people.
You're kind of going backward.
Yeah. Across the country, housing authorities are going backwards right now. In Houston, I'm proud to say we're serving 1,000 more people today than we were a year ago.
That's wonderful.
3,000 more people than 3 years ago. So we've continued to be able to increase our service, but that's not the case of many housing authorities.
Now, you tell me if I'm mistaken. Minimum wage is what?
$7.25?
I think it is. I think it's $7.25. If $7.25 is the minimum wage, and we as a country know that, mm-hmm. and a person who is working 40 hours with a family, let's just say that's what they're making, is it is fair to us to believe that they ought to be able to find affordable housing within the confines of that salary, that income bracket, right?
Well,
or is that wrong?
It is the idea of, is the minimum wage the same thing as a living wage? And, you know, in Houston, that's clearly not the case. A living wage, I think, is closer to $11 an hour. There's a question of what is a fair wage rate. And I think that you're highlighting kind of one of the groups that depends on affordable housing is the service industry.
Yes.
Your fast food workers, your hospital orderlies, these are folks who simply can't make ends meet on one full-time minimum wage job. And many of them will have multiple jobs just to try to make ends meet.
So if the affordable housing is not affordable for those that should be able to afford it, who is living in this? Who is it affordable to? The person who's making $11 an hour? Is that what you're saying?
So there is a range of affordable housing.
Okay, let's talk about that.
In Houston and across the country. And so public housing and the Housing Choice Voucher program, which is also known as the Section 8 program, are programs that provide affordability, and we would say it's a deep affordability. So even somebody who had no income would be able to stay there. The truth of the matter is most of them have income. And then there are other programs. The tax credit program is a very popular program, and it's affordable housing, but it's more affordable for people who are at the 50% AMI. So a family of four, someone making $30,000 a year, or $35,000 a year. And that would not be affordable to somebody who's at minimum wage. They wouldn't qualify for those units.
What about seniors?
So seniors really depend on public housing and the Section 8 program. Their pensions rarely would put them in a place in Social Security that they would have enough income for the 50% or the tax credit housing. And so they really depend on our programs. In fact, most of the people on our programs are children, elderly, and disabled. And it really is, it's a myth that public housing is full of welfare queens.
Well, you know, that was a question that I really wanted you to address, and I want you to really expound on it as much as you're able to.
Sure.
Can you, who would be more acquainted with the myths that surround your organization? Because we all know Section 8 and anything to do with quote-unquote affordable housing.
The
there are
projects.
Exactly. There are all of these myths. There's even myths concerning what affordable housing looks like, and it's not necessarily project looking. It doesn't mean Section 8 doesn't mean you have to live in substandard housing.
Right.
Get rid of some of those myths for us, and then if there are some that are real, let us know what those are.
So I think the first myth is that these are lazy people, that these are people who are just looking for a handout. And I think when you step back and you say, well, you know, in Houston, only 33% of the people are not children, not elderly, and not disabled. I mean, those are huge categories that you just take right off the shelf. And so of that 33%, over 50% have jobs. Most of them are working. And it simply is that the jobs don't pay enough, or their skills aren't high enough to be able to afford the private market sector. I think another myth is that once they get on housing, they stay there forever. And in Houston, in the Section 8 program, the average tenure is less than 5 years. So you have a lot of people who are using it for less than 2 years, that they use the program at a hard point in their life.
Isn't that what the program's for?
And they take advantage of that opportunity, and they go back to school, they get their GED, they get their college degree. We recently had a graduate of one of our self-sufficiency programs who bought her own house after being on the program for just 4 or 5 years. And so I think that's one of the myths, is that people just get stuck there and they never leave.
That means that 77% of the individuals that are taking advantage of affordable housing are exactly who it's designed for.
Yeah, if not higher.
If not higher, but we can say for sure at least 77%.
Yeah, I think there's a philosophy that you hear people talking about of the deserving poor, and is this an entitlement program? Well, it's not an entitlement program. I don't have enough to go around. It's not like Medicare or Medicaid, where if you qualify, you get it. I have thousands and thousands of people who want the housing that we offer, that they can't get it.
Because the waiting lists?
Because the waiting lists are so long, and I serve about 60,000 people here in the city. And I'm doing everything I can to serve more, but Washington isn't giving me any more money, so I can't just turn on a faucet and create more units. And so the question of who is deserving of this assistance is one that people often talk about. And I would say that I think everyone agrees that we need to take care of our elderly, our disabled, and our children. And those children have parents. And so you kind of say, well, 100% of the people who are taking advantage of the housing qualify, and if they don't,
deserve it.
And if they don't follow the rules,
then that's another story.
They move on.
There are
Yeah.
consequences. That is so very. That if you didn't drive any point home today, that was probably the best thing that you could have said today. This is Tory Gunsolley. He is the president and CEO of the Houston Housing Authority. His physical address is, or I should say, their physical address is 2640 Fountain View Drive, Houston, Texas 77057. Phone number 713-260-0600. 713-260-0600. Website housingforhouston.com. www.housingforhouston.com. We are so pleased that you took time out of what clearly must be a very busy schedule to spend it with us, and we really appreciate you bringing clarity to, well, defining homelessness in the previous segment, and then giving us clarity and definition concerning affordable housing. It's been really, really helpful. Thank you so very much.
Anytime.
Well, I believe that,
Yes.
and I'm sure you'll hear from us again. We are so pleased that you chose to spend time with us. We're going to look forward to seeing you the next time right here on Joy in Our Town. Goodbye for now.